Hello, my name is Zen, and today for this presentation and for my overall research project, I want to go over the controversial and unethical surgeries that are done on canines and felines in the veterinary field. I wanted to give a little table of contents. I first want to go over the different surgeries that I will go over during this presentation, and then I want to discuss the issues that can happen to animals whenever they are undergoing this anesthesia for these surgeries and any other surgeries that they may or may not undergo. I then will go over the history and explanation of each of the surgeries. I also wanted to include rhinoplasty surgeries on brachycephalic canines, which is the smush face dogs, because as much as I am going over the unethical and controversial surgeries, I did also want to include one that is helpful for dogs. The surgeries that I will go over today are tail docking, ear cropping, declaw, and debarking, or moreover known as devocalization. Many people believe that whenever an animal undergoes these surgeries, they actually are in minimal to no pain, both directly after and afterwards in the long run, which is false. They also believe that these surgeries tend to help the animals, whenever that is also false. Firstly, I want to discuss the behavioral and neurological changes and issues that can happen from the animals undergoing anesthesia. While many of these surgeries do include anesthesia, including debarking or declaw, it is on the occasion that if an animal gets their ears cropped, they actually will not go under anesthesia if they are under a certain age, as well as if a puppy is less than 8 days old, they will not go under anesthesia for their tails to get docked. Um, Many animals, whenever they are waking up from anesthesia, they will have that first little bit of grogginess from first waking up. And while many of them will fully recover and be fine, there is the occasion that they do not, or that they end up having medical issues for the rest of their lives. This includes stress hyperglycemia, which is very common in cats. Whenever they are under anesthesia, they have a slightly lowered insulin level, and depending on how long the animal is under anesthesia, as well as how much lower the insulin level goes, an animal could end up, whenever they are stressed, at any point in time, their insulin levels will actually end up getting lowered during that time, causing a lot of heart and medical issues. And then the vet may believe that the animal now has diabetes, and then they're getting insulin for reasons that they would not need. This anesthesia can also cause immunological issues, such as the immune system becoming quote unquote depressed, making it to where not only do they not fully recover from the initial surgery, but also if they end up going under any other surgeries or having any sort of abscess, wounds, cuts, scrapes, anything like that, they may not be able to heal from that as much as they would have beforehand. The medicines that a dog or cat is administered both during and after the anesthesia can affect them, such as propofol, which is the most common one in order to knock them out so that they can be asleep for the surgery, can cause neurotoxicity to the brain, as well as respiratory depression or apnea. There is also very commonly behavioral changes that can include stress, anxiety, depression, even aggression, even if it's simply just anytime they get stressed out or anytime that they go to the vet or to anywhere that they do not like. But this can also happen 24/7 during any sort of situation. This can also include self mutilation, such as excessive grooming to the point where they are going bald in a certain spot or constantly scratching in a certain area or biting themselves, as well as excessive or less grooming, and occasionally anorexia because they are so in pain or depressed that they no longer want to eat. The first surgery that I want to go over is tail docking and ear cropping. While they are very common, they are seen as very highly unethical and controversial, as the people that are actually having their pets undergo these surgeries do not fully understand them. While there are many puppies that the breeders will instantly get their tails docked before they turn 8 days old, many people will still get them done even after they, say, adopt a puppy from the shelter and want to have their tail docked. They believe that this can help to prevent happy tail, as well as if they get their ears cropped, they believe it can prevent ear hematomas, ear infections, or even heighten their hearing, which is not true. Ear infections are actually down into their ear canal, which does not matter if their ears are cropped up. And ear hematomas, while it will help to prevent them from happening, it is still very likely that they can still happen. It has also been found through studies and tests that people that see these dogs with their tails docked or their ears cropped will more likely see the dogs with these modifications as unattractive, as aggressive, and less likely to go up to you and your dog, or even want to be friends with you and like go to your house because of these modifications. And many people that do get these done to their dogs do not realize this. This is an example. On the left, you will see a Doberman that has his ears cropped and his tail docked, whereas on the right, you will see that that is a completely natural Doberman. And just by looking at this picture, you will probably personally feel as though the dog on the left is more aggressive and scary than the dog on the right. Decline cats is not seen to be as controversial, but it is a very highly unethical surgery. You will see that more veterinarians will perform this surgery, but it is still seen as very invasive and difficult for cats to undergo. Usually, it is either done to either all four of their paws or just their front two paws. Um, in humans, it is similar to removing this top part of your finger and having to relearn how to use your hands. It causes excruciating pain, not only right after the surgery whenever they first wake up, but constantly every single time that they are having to walk. This can end up causing severe depression, and they end up never fully recovering. People believe that the surgery helps to prevent the cats from clawing up their furniture, or if their animal is destructive or aggressive, they believe that this can help, but it does not. If anything, it would make it worse, as they are now having to learn a new way to walk and are in constant pain. This is an example. Whenever the cat is not declawed, there is a bone that is right underneath the claw or their nail, and whenever they are declawed, it is removing that half of the bone and actually partially exposing it, making it severely excruciatingly painful. Deep barking is not highly common or well known, but it is highly invasive and unethical and controversial. It is performed by actually removing tissue from the dog or cat's vocal cords, and it is usually done either through the mouth or through a incision that is done on their neck. This is done with the intention of softening or completely silencing their bark or the cat's meow, with the idea that this will help them to, say, not have to take their animal to a shelter or have to get rid of them, or say if they have neighborhood complaints from their dog barking. If a dog is to undergo one of these surgeries, it is actually very highly likely that they will have to undergo a second or even third surgery due to complications such as infection or the throat narrowing in on itself, and the dog can no longer breathe or eat or drink properly. While there are a lot of controversial surgeries in the veterinary field, rhinoplasty is not one of them. Um, Brachycephalic dogs, or the swish-faced nose dogs, such as pugs or boxers and Boston Terriers, they are unable to breathe as properly as dogs that have the nose that is outward, such as Border Collies. Um, their nose has a curvature on the inside, making it even harder to breathe, as well as then they end up having breathing issues, lung issues, and occasionally even heart issues. So doing this rhinoplasty surgery can not only help to prevent or resolve those issues, but it will help to be able to breathe better in general. Doing the surgery can be done either with cauterization or by taking suture and blade and removing the area of the curvature on the inside, which can be done in 3 different ways by removing different parts of the nose. This in all 3, and cauterization as well, so all 4 ways have been seen to be equally efficient. Here you can see on the left is a dog that has not had this surgery, and then on the right is right afterwards, completely opening up that area in order for them to be able to breathe better. So thank you, and if you have any sort of questions, don't hesitate to ask.